Welcome back to COVID Conversations, our COVID-19 video series. We are about to begin part 2 of our 3-part video series about COVID-19. So we've discussed the symptoms of COVID-19 and we've discussed what you need to do in order to reduce your likelihood of being exposed to COVID-19. So let's get into the nitty-gritty about what is isolation and what is quarantine. So what should you do if you become sick? First, you need to isolate yourself immediately. And this is whether or not you happen to have symptoms of COVID 19, if you got tested for COVID 19, and even if you got tested for COVID 19 and showed up as positive, but have no symptoms, you still need to isolate. And we'll talk more about that in a little bit. Do not go to work, school, the gym, your friends' houses, a party, the grocery store, etc. You need to stay home. Do not have any visitors over at your house. If possible, stay in a separate room from others in your household. I know that might be difficult, especially if you have a roommate or a housemate, but it's really important that you're not sleeping in the same room as someone else if you happen to be positive or have symptoms of COVID-19. Have only one household member take care of you if it's needed. And if they are taking care of you, they need to be wearing a mask, disinfecting often, and wearing gloves. There's more information about how to take care of someone who has COVID 19 on the Centers for Disease Control website. I also want to mention that if you happen to have a sexual partner, you really need to not be around them at this time. You shouldn't be sleeping with them or having sexual activity with them. Please wear a mask when you are around other people if you have to be around other people. This includes in public and at your house. Of course, the best thing to do is to not be around other people when you are contagious. But if you have to be, you need to wear a mask. You need to wash your hands often, cover your coughs and sneezes, avoid sharing personal household items. So that includes like utensils or dishware. So if you're in a household with other people and you're sick, you really should have a designated set of dishes that are only for you and no one else is using. You need to clean and disinfect all high touch surfaces. This is especially important if you have to be using other rooms as other people. So, for example, the bathroom. If you are sick, every time you use the bathroom, you need to disinfect it right afterwards to make sure that there are no fomites or risk of transmission to any of your roommates. You also need to monitor your symptoms every day. That includes taking your temperature twice daily and just kind of keeping an eye on any of your respiratory symptoms or other symptoms that you might have. Regardless if you get tested and you test positive for COVID 19, you need to look for these emergency warning signs for COVID 19. Some people haven't had any symptoms of COVID 19, or maybe they were symptomatic and then they get better and then they suddenly get worse. Regardless, you need to keep an eye out for these symptoms. And if you happen to have any of these symptoms, you need to seek emergency medical care immediately. These symptoms include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. Of course, this list is not all possible symptoms, so you need to call your medical care provider for any other symptoms that you have that are severe or concerning you. If you are living with someone and you're sick with COVID-19, or even if you have a emergency medical contact, you should really develop a plan for what to do if you happen to have any of these symptoms. You should call 911 or call ahead to your local emergency facility. If you do, please notify the operator that you are seeking care for someone who has or may have COVID 19, or if you yourself have COVID 19. Let's dig a little bit deeper into what isolation actually means. So, the definition of isolation is the separation of sick people with a contagious disease from people who are not sick. Now, this goes for people who have symptoms of COVID 19 and test positive, for people who have symptoms of COVID 19 but aren't able to get a test, and for people who test positive for COVID 19 but are asymptomatic or have no symptoms. So when you're in isolation, you should not go to class, you should not go to work, you should not go to social gatherings, you should not have people over. You need to separate yourself from others in your household, including anyone that you share a bed or room with. And if you have to absolutely be around someone, you need to wear a mask to protect them. So, if you test positive for COVID 19, a case investigator from the health department will contact you. They will need you to do a few things. First, you need to answer the call. I know people do not usually answer a number that they are unfamiliar with, but rest assured, if it is the Virginia Department of Health, then we will be using a number with a 540 area code, or the caller ID will show up as the Virginia Department of Health. If you do not answer, the case investigator will leave you a voicemail stating that they are calling from the health department and that they need you to call them back. They will not provide you with your test result over the voicemail. You will have to verify your identity first before they provide you with the results. They will also never ask you for information about any bank accounts, your social security card, or for money. They will ask you about where you went and who you spent time with during your infectious period. This would usually be 2 days before you started to have symptoms if you are symptomatic, or 2 days before you got tested if you are asymptomatic. The more detail you provide us, the more likely we can stop the spread of COVID 19. This is because we can identify people who might be considered close contacts and are at risk for exposing other people. Once we receive their contact information and the information about where you went during your infectious period, the contact tracing investigation will begin. We will discuss more about that later in this presentation. Finally, the case investigator will provide you with information about how to isolate yourself and how long your isolation will be. Remember that they are a supporting resource for you if you have any questions about COVID 19 and your isolation period. So let's take a deeper look into why it is important to notify your close contacts if you actually don't feel well and have symptoms of COVID 19 or if you test positive for COVID 19. And also why it is important to tell the public health nurse or a case investigator about your close contacts and where you went when you were contagious. Remember, it usually takes 2 to 14 days to experience symptoms of COVID 19 after you are exposed and you are contagious before you actually start feeling those symptoms. Okay, so we have talked about what you need to do if you are sick with symptoms of COVID 19 and what you need to do in case you are positive, you test positive for COVID 19. We've also discussed the importance of identifying your close contacts. Now let's discuss what you need to do in order to get out of isolation. So there must be three things that happen in order for you to continue to be around others and get out of isolation. The first three things are 10 days must have passed since your symptoms first appeared. So, looking at when you first had symptoms, say maybe you first experienced a fatigue or a fever or a cough, then count 10 days after that. And you need to have gone 24 hours with no fever without the use of fever reducing medication. So, for example, you can't have had a fever and also not been taking Tylenol. So, no fever without any use of fever reducing medication. And finally, your other symptoms of COVID 19 must be improving. Now, a note here, it has been documented that the symptom of loss of taste or smell can potentially last a little bit longer than your contagious period. So when we talk about these symptoms, we're really talking about, the fatigue, the cough, the fever, the shortness of breath, the nausea, diarrhea, etc. So those symptoms all must be improving. Remember that you always have your case investigator to help you determine when your isolation period will end. And if you are not able to get tested for COVID 19, but you're symptomatic and you are pretty sure that you have it, there are a lot of resources on the Centers for Disease Control and the Virginia Department of Health websites that provide information about when you should end your isolation period. I will leave those resources at the end of this presentation. Finally, you can also call the Virginia Department of Health COVID 19 call center. I'll also leave that number at the bottom of this presentation. So, what if you tested positive, but you had no symptoms, so you're asymptomatic? You can be around others after 10 days have passed since you got your positive test. So, since you actually received your test, so you went in, you went to the doctor's office, or you went to student health and you actually got the nasal swab PCR test, 10 days must have passed since you received the test. And you developed no symptoms of COVID 19 in the meantime. If you start developing symptoms, that's going to change your isolation period. And again, if you happen to test positive for COVID 19 and you're asymptomatic, your case investigator will be able to help you to determine when your isolation period ends. Let's take a deeper dive into what it actually means to quarantine. Now, I'm sure that we all heard from our friends and family, or maybe even you've said this, that during quarantine I started baking, or during quarantine I binge watched a new TV show. I personally became a crazy plant lady. But in this instance, this is not the quarantine that I'm referring to. Unless you were exposed to COVID 19, that was staying home, most likely because of the stay at home orders or because you desired to reduce your risk of exposure to COVID 19. The definition of quarantine is the separation of people who were exposed to a contagious disease to see if they become sick. This often involves some level of restriction on the movement of those people. You will need to quarantine for 14 days after your last exposure to a symptomatic person or a person who tests positive. This means that you absolutely should not go to class, you should not go to work, you should not go to any social gatherings. You should not have anyone over to your house, apartment, or room. You need to separate yourself from other people in your household. Absolutely, you need to wear a mask when you have to be around other people. We also need you to monitor your symptoms every day to see if you do become sick. You cannot test out of quarantine. So, for example, let's say that you get coffee with your friend Leanne, and a few days later she tells you that she tested positive for COVID. You will need to quarantine for 14 days since the last time you were around Leanne, and you're going to need to monitor your symptoms during that period. Let's say that you get tested on day 5 of quarantine, and you find out on day 8 that the test was negative. Even though the test is negative, you still cannot get out of quarantine early. You need to finish out the full 14-day period. Remember that symptoms of COVID 19 can appear anywhere from 2 to 14 days after exposure. It is possible that you tested too early in your infection and that your viral load was too low for the test to pick up that you were in fact infected. Therefore, your test would be considered a false negative. So, bottom line, you cannot test out of quarantine. Finally, we all need to normalize proper quarantine measures so that our friends, family, and peer group all follow the proper public health guidance when asked to quarantine. A few ways that you can help normalize proper quarantine measures are by maybe telling your friends that you can't get dinner because you're on quarantine, or declining your friend's invitation to come over and hang out with you to keep you company while you're in quarantine. Consider having a Zoom date with your significant other or your friends or family rather than having that person come over and hang out with you in quarantine. So, who would be considered a close contact to a positive COVID 19 case? So, the definition of a close contact is someone who was within 6 feet of an infected person for at least 15 minutes, starting from 2 days before the illness onset or when the person who is positive had symptoms, or for someone who was asymptomatic and didn't have symptoms, it'd be 2 days prior to when they got tested, and until the time the patient is isolated. So, we'll discuss more what that actually means here in a few slides. But moving on. This is true with or without a mask. So if you were wearing a mask while you go to work or to class or go to a party or hang out with a group of friends and someone tests positive in those instances, then you would still be considered a close contact and would still need to quarantine whether or not you wore a mask. So some examples of individuals who might be considered a close contact include any roommates or housemates, sexual partners or significant others, any friends that you hang out with, participants in a social gathering where social distancing is not achieved, any colleagues that you work in close proximity with, anyone you carpool with. So let's consider that in close congregate settings where you can't adequately social distance and there are multiple people, do you actually know who you were around and potentially who you were exposed to? Moreover, if someone tested positive after these events and they actually were at that event, would they know or remember who was at that event? Would they remember that you were there and that you were considered a close contact? This situation could easily become similar to what happened to Nick and Maria in our earlier example, mainly that you might be exposed to COVID 19 and not be notified because a person who is positive doesn't report you as a close contact because they either don't remember or worse, perhaps they are ashamed of reporting where they were, where they went, and who they were around, and therefore they didn't report their close contacts to their case investigator. then you could continue to potentially expose other people without even knowing it. This is a really good reason why staying home and avoiding large social gatherings can be the difference between getting COVID-19 and not getting COVID-19. And it can be the difference between spreading COVID-19 and not spreading COVID-19. So, if someone tests positive for COVID-19 and they identify that they were around you during their infectious period, then a contact tracer will call you and tell you that you will need to quarantine. We have already discussed what you need to do to quarantine properly, but let's explore what happens when a contact tracer actually calls you. So, the contact tracer will use the information from the case investigation interview with the person who tests positive. If you are identified as a close contact, then the contact tracer will call you. Once again, if a contact tracer calls you, please answer the call. If you do not answer, they will leave you a voicemail stating that they are the health department and that they need to speak with you as soon as possible. They will not notify you that you were a close contact for a known case of COVID-19 over voicemail. They will need to speak with you first. Remember that they will never ask you for any money, your bank information, or your social security card number. That is a scammer and you should call the police. So once the contact tracer gets a hold of you, they will tell you when you were exposed. If the person who's exposed gives the health department permission to tell you that they are positive, then the contact tracer will ask you when you were last around that person. From there, they will determine the length of your quarantine. They will also walk you through how to monitor your symptoms daily, which is key in finding out if you are indeed infected. They will also provide you with an option to sign up for SARE alerts. SARE Alerts is a text-based monitoring system that prompts your daily report of your symptoms through text, email, or phone calls. All you have to do is simply reply either no, I'm having no symptoms if you are indeed having no symptoms, or yes, I am having new symptoms. If you select yes, a public health nurse will call you to check in with you and make sure that you are okay, that you have the resources that you need, and support that will help you get through. It is really important that you sign up for SARE alerts and use it every day during your quarantine period. And as a friendly reminder, you cannot test out of quarantine. So let's go a little bit deeper into how you actually are able to get out of quarantine. And again, you cannot test out of quarantine. So I have four scenarios here that might help illuminate and provide you with more information on what you actually need to know in regards to when you can get out of quarantine. So the first scenario is pretty cut and dry, okay? You have close contact with someone who has COVID-19 and you have no further contact or interactions with that person while they are sick. So for example, you see your friend Martha at the coffee shop. You guys get coffee together on Wednesday the 1st. And then you don't see her at all after that. You find out that she actually has COVID 19. Let's say you find out on Saturday. So you would actually start the first day you saw her, and then that was the last day you saw her. So the quarantine starts with the last close contact you had with that person, and then add 14 days. That would be the last day of your quarantine. Okay? Now, that's pretty cut and dry. Let's look at scenario two. So, this scenario, you live with someone who has COVID 19. So, for example, a partner, your roommate, a family member. And that person has isolated by staying in a separate bedroom and has not been around anyone since they actually tested positive or had symptoms of COVID 19. And you have had no contact with that person since they were isolated. And this is absolutely no contact. So your last day of quarantine would again actually be the last time you saw or you were in close contact with that person. So the person starts home isolation, and you do not see on the first, and you do not see them at all, have no interaction with them at all. You would then be actually able to get out of quarantine after 14 days. So it's really important that you look at the date the person with COVID-19 began home isolation and you had no contact with them plus 14 days equals the end of quarantine. But you cannot have had any interaction with them in the meantime. If you do have interaction with them, that's actually going to postpone how long the quarantine is going to be. And we'll get into more of that information here in a sec. So scenarios three and four get a little more complicated, so just bear with me here. So for scenario three, you're under quarantine and had additional close contact with someone who has COVID-19. What do you do? So Say I live with someone who has COVID-19 and I started my 14-day quarantine period because we had close contact. But what if I ended up having close contact with the person who is sick during my quarantine? Or what if another household member actually gets sick from COVID-19 as well? Do I need to restart my quarantine? The answer is yes. You will have to restart your quarantine from the last day you had close contact with someone in your house who has COVID-19. Anytime a new household member gets sick with COVID-19 and you had close contact with them, you will need to restart your quarantine period. So, for example, let's look at the calendar. Say that I have close contact with my roommate on the first of the month and I don't see them. I find out they have COVID. I don't see them again. But on the 5th, my other roommate actually gets sick and has symptoms of COVID-19. If I'm not exposed to that other roommate or the first roommate at all, then my quarantine would start again on the 6th and on the 19th. Now, for scenario 4, this is an example of if you absolutely cannot avoid further close contact with the individuals in your household who are sick. So maybe you're taking care of them, maybe you absolutely have to share a bedroom and you cannot separate away from them, or maybe there's no availability in your living quarters for you to maintain that proper 6-foot distance. So in this situation, you should avoid contact with others outside of the home at all times while that person is sick. And then you can actually start your quarantine once that person has met the criteria for ending home isolation. So remember those 10 days plus 24 hours of fever free plus having improved symptoms of COVID-19. Well, that's when you would actually start your quarantine period. So for the example here on the slide with the calendar, if the person who's sick actually started their isolation on the Monday the 30th, or that's when they started having their symptoms, and they were able to actually finish out their criteria for home isolation on Thursday the 9th, you would then start your quarantine on the 10th, Friday the 10th, and it would end the last day would be the 23rd. Now, again, with any of these examples, if you are talking to a case investigator or a contact tracer, they will help you determine when your quarantine will end. And if for some reason your close contacts or yourself were not identified by the health department, either your person who's infected didn't get tested, or if you were told you were a close contact but never named when the person who was infected did their health department interview, you can always look up this information on the Centers for Disease Control website or the Virginia Department of Health. I think a great question here is, what if I don't want to quarantine? Well, first, you should quarantine to protect your community. Quarantining, if you are exposed to COVID-19, is one of the best ways that we can reduce the likelihood of spreading COVID in our community. And in the end, it will help us open back up our community faster. Also, legal action can be taken. And this is directly from the Virginia Department of Health policy. So if a person does not comply with voluntary quarantine, the VDH may issue a quarantine order that legally requires the person to comply with quarantine restrictions. Law enforcement can become involved if needed to ensure compliance. Obviously, using law enforcement is not going to be our first stroke of action if you are having a hard time quarantining. We will work with you and educate you and provide you with information and resources if it's difficult for you to quarantine. But in the end, we have to remember that if we're going to beat the virus, then we all need to take these preventative steps together to help reduce the spread of the virus. And quarantining is a huge, huge step. And that concludes part 2 of our video series. If you have any questions, please feel free to email us at cshtinfo@vdh.virginia.gov. You can also call the Central Shenandoah Health District at 540-332-7830. Be sure to follow the Central Shenandoah Health District on Facebook to find out about local testing events as well as to find out more information about COVID-19. And finally, you can always call the Virginia Department of Health's COVID-19 call center at 877-275-8348. Part 3 of this video series will discuss what you need to know when you get tested for COVID-19, and it will also wrap up our video series with some final ideas. Thanks.